For the hips, Paul?
So this is not meant to be self-diagnostics. I'm just going to show you a few ways of testing to see if there might be issues around the hip. You're thinking about lack of range of motion and or pain when you're doing these. So first, if you can lie back on a table, you can do it on a bed, and just lie right back and try to pull both knees up towards your chest. That should come up in a nice free range of motion. Your thighs should touch your chest. Then you want to do one knee at a time, and the knee should come pretty well straight up. It shouldn't get kicked out to the side. That can be some issues with the hip joint itself. One leg and then the other.
Can we show that one more time from this angle, just so you can see? Show them what you mean by getting kicked out to the side.
So when you're bringing the leg up by itself, it should come more or less straight up and not come up and want to go way to the outside and pinch when you're trying to pull it straight up. You should be in line with the rest of your body.
Perfect.
Then a test for your muscle length, hip and thigh, sitting on the edge of something high enough that your legs are dangling. Pull one leg up towards your chest, then lie back and see where that other leg goes. If your hip flexor is tight, that leg is going to want to come up like this. If the quadricep muscle and the rectus femoris muscle are tight, then the leg is going to want to straighten at the knee. So that tests those two muscle groups. The second last thing is to do what they sometimes call a figure four, where you just lay the ankle across the other knee and let the leg drop down.
We're looking for about one fist length there.
Yeah.
So we know your hip is pretty good in that position because I can't get my fist up.
That's right. And then the last thing, to check internal and external rotation at the hip, you're just going to sit like this. You don't want to let that thigh move all over the place. This stays nice and straight, and you're just going to externally rotate the hip. You should get somewhere 40 to 45 degrees, and then internally rotate the hip about the same amount. So that gives you an idea if there's any real strong variation from one side to the other, or if you're having any pain, then that might be an issue that needs to be checked.
Awesome.